Thank you, Dr. Murli, ARC, AIOC for the opportunity. Always a good place to meet friends. So I'll be talking about optic disc edema workup and differentiating it from pseudo edema, if this moves forward. Yeah. So the most important thing is knowing what is a normal optic nerve head. The key things to always look for, and our approach to the disc is a little different from the way glaucoma people talk about it. The shape, size, margins, cup, the neuroretinal rim, the vessels, and the peripapillary area, essentially in that order. But we are looking at the margins of the disc and not just at the cup. Although frequently cup changes have a bearing on how the disc appears. So the absence of a cupping either could be indicative of a very small disc and therefore the pseudo edema appearance, or else there is a true edema and the cup is now absent and filled up with fluid. So all these aspects of the disc we need to always look for carefully whenever we are identifying. And as one of my seniors used to say, you see a normal 1,000 discs before you start identifying abnormality. So stereoscopically see 1,000 discs before you start understanding the undulations and the elevations are normal or a part of a disc edema. So obvious disc edema would have a lot of signs which usually are not difficult to pick up, like loss of cup, elevation of the disc significantly over the rest of the retina. The margins are blurred, there is nerve fiber layer edema, and there could even be so much fluid that there could be retinal and choroidal folds. The vascular signs would be disc hyperemia, dilatation and tortuosity of the peripapillary vessels, peripapillary hemorrhages, the exudates that start getting evident as the fluid may get absorbed, and of course the cotton wool sign kind of things. So the mild edema could just be a blurring at the polar or at one edge of the disc, especially the nasal side, where the fluid starts collecting, and again it requires stereoscopic assessment and often may not be easy to pick up. You'll have to look for that little hyperemia in that area and the blurriness of the margins. As it progresses towards moderate edema, the entire disc, the vessels start getting obscured. One of the key things to look for is the vessel structure and appearance is absolutely normal beyond as it goes outside the disc, but closer to the disc it's getting partially obscured by the fluid and at the margins. And as the disc edema starts progressing, you can start seeing all the signs we talked about. Pseudo-papilledema is an appearance of a disc edema when it is not actually due to an axonal swelling, and the vision may not be normal even in papilledema or raised ICT, resulting in bilateral disc edema. The vision may be normal in early cases. The pupillary reflexes would be normal both in early, but papilledema will start showing changes of visual function and pupil reflexes. The pseudo-papilledema disc would be a small cupless disc but with normal vessels. But because the size of the disc is small, often there is not enough space for the vessels to bifurcate and divide inside the disc that normally is a part of the disc, and therefore the vessels come up and then divide, and so you have thicker tortuous vessels on the surface of the disc. You can have abnormal branching that the vessels would show, again because they did not branch or normally divide as they would deep inside the disc as they enter into the globe. And of course fluorescein angiography can be fairly helpful. Our approach to a disc edema, of course, would be whether it's bilateral or unilateral. So presence of bilateral, of course, eliminate or rule out a pseudo-papilledema, confirm whether there is true papilledema and whether it is, so papilledema essentially meaning that it is probably due to raised intracranial pressure. Other causes could be diabetic papillopathy, malignant hypertension, occasionally bilateral papillitis, and inflammation, toxic, and again in adults, optic neuritis, bilateral, although less common. Hyperemic disc, if it's unilateral, essentially showing, meaning that the other eye or the other side of the eye is normal. You look whether it's hyperemic or pale, although even in AION in the initial periods, the disc could be hyperemic, but over time you'll start seeing a pallid segment in the disc. A hyperemic disc would be papillitis, neuroretinitis, AION in the initial period, venous congestion. So just showing you that like how it was initially the AION, it was not looking so pale, but over time you can see as the other eye is showing you a previous evidence of pallor, which was a late stage. So patient presented with old AION and fresh AION in one eye. Just to show you, the OCT also shows you changes. So the one eye affected eye is showing you massive edema on the nerve fiber, and the other eye is showing you the loss of nerve fiber that occurs progressively with time. So these are the other way the OCT can tell you. One is, of course, you can look at the structure of the disc on the OCT and you will see the massive edema that you can see, plus the angle as the sclera approaches the optic nerve. There will be, because of the edema, this angle starts becoming negative and going further inwards towards the disc, showing that there is a lot of fluid in the retrolamellar part that is pushing the disc in front. So these are features that are suggestive of disc edema and true edema instead of a pseudopapilledema. These are all the various causes that can be mistaken for true edema: myelinated nerve fiber, tilted discs, hypermetropic disc hypoplasias. Buried and exposed drusen's are very important causes of pseudopapilledema, and you can see a lumpy, bumpy disc on it. And these are the OCT features. So OCT can help in identifying an optic disc drusen presenting as a pseudopapilledema versus a true papilledema. And as I mentioned, fluorescein angiography would show leakage in the early and late phase, whereas drusens would only either show a pseudofluorescence or, of course, may show a mild amount of staining in the subsequent period. Again, oblique inserted discs can appear like elevated disc or disc edema on the nasal part and can be mistaken for them. So essentially, good clinical examination and OCT can be helpful in differentiating true from pseudo disc edema and, of course, understanding the causes of true disc edema.